My name is Mika Taylor. I'm the Director of Financial Planning at Muir Health. We're out in California, 45 minutes east of San Francisco, two-hospital health system with a behavioral health center and a physician network, and then we have our administrative services. The session was kind of about our journey and how we're leveraging the management reporting and rolling forecasting because we have adopted the concept of advanced planning, or you hear dynamic budgeting. So we basically don't do an annual budget at the department level anymore. We do a system level annual budget, but then we really have the departments manage to metrics and utilize a rolling forecast to produce our system level budget the next year. So we decided to change because it was such an exhaustive process. It took up a lot of time, and it wasn't allowing us to incorporate new things into the next year. So it was really pioneered by our CFO. So he was like, we can't do this anymore. I don't know what the answer is, but we got to do something else. So as I spoke in my session, coincidentally, I had been that prior year kind of already talking with you guys with Strata about the concept of moving to dynamic planning. There were some systems that we're already doing at Mission Health, Park Nicolette. They were great to do reference calls on. So I was kind of building the case. And then when he said, let's do something different, I'm like, well, let's try this. So he talked to his peers, the rest of our C-suite, to really get the organizational buy-in. I mean, he did the right socialization all the way up to our CEO, board members, finance committee members, just to make sure the organization had the appetite. We were kind of fearful that there was going to be resistance there. We weren't going to be able to do it. They were in, and some were in, but they didn't really know what they were in for. And then some of our C-suite members went to, I don't remember which conference it was, but it was kind of one of the hospital leadership type conferences, and came back, and one of them's like, I'm in, I'm sold, we're doing this. And then that kind of kept on that momentum, and then just kind of kept meeting to talk about it, trying to communicate it out to the organization. And thankfully we didn't have much resistance as we went through it, because you start from the top. If they see your leader kind of on board, everyone's gonna kind of get on board too. So that's the one thing I think that's unique about Strata. It's healthcare, technology, but the people genuinely care about wanting to be. I have not met a Strata employee that's not happy and does not love their job. I think it's so cool. I always say, if I move to Chicago, I'm gonna kind of be knocking on that door. To have a tool that's healthcare specific, that understands your needs, what's going on in your industry, and then the partnership. We would not have been able to do this without the professional services practices and kind of the rollover support. I mean, it was huge. It would have that collaboration partner. There's no way we would have been able to roll this out, tackle the culture change, and communicate that out. So I really appreciate being able to partner with you guys.